When is someone going to recognize the fact that we're all veterans and we deserve better than what we are getting at the VA? It's not fair. And all I want is someone to help me.
Tonight was a town hall meeting with the System Worth Saving Task Force of the American Legions, VA, and our commission. VA and our, of course, Veterans Affairs and Rehabilitation. We are doing a site visit at the Roudebush VA Hospital here in Indiana, and we'd like to start our site visits with a town hall meeting before the visit so that we can get the pulse of the hospital from the patients, from the veterans. We had the VA here with us tonight. I'm very glad they were here. We were able to resolve some of the issues here on site. That's always a good thing. We had people from congressional offices here. They got an earful, certainly, about what some of the problems are here locally.
I'd like to see an advocate at that desk as well. So if there's any comments or concerns that a veteran has, we don't have to go downstairs, around the corner, on the 5th floor, what have you. They're right there, first line of sight, to help us when needed.
There's some very fine people at the VA. You're lucky to have some really good people working there. They're just a small percentage. When you run into, especially a doctor that's kind of a loose cannon, it can cause you so much problems. You're overwhelmed.
I have numbness and tingling in my hands if I do normal things like sweeping, mopping. I went to the VA, sat there for 3 hours, and was told finally that, oh, and this is the honest God's truth. He came in, sat me in a chair, and said, oh, you just need to sit up like an 18-year-old. He takes my shoulders and pushes me back. Turned around and walked out. I never even got a chance to talk to him again.
What we're doing is trying to assess the timeliness and the quality of health care in the VA hospital. That's our overall mission. And whenever Verna Jones, the director, and I go in for the next day and a half at the VA, where we will do interviews with the administrative team and a variety of different staff in business and healthcare, in quality management, in patient advocacy. I mean, a whole litany of different areas that we assess. This is prepping us for that. Things that we've heard here tonight, we will follow up with those issues over the next day and a half.
I'm here representing my father, who died recently, almost a year ago, and he retired after 21 years, and my mother fought for his benefits for 13 years.
He said, yes, you have problems, but you cannot see a doctor today. And I said, why? Because you haven't been here 30 days, assigned to this clinic. That is ridiculous. Why do I have to wait 30 days? And they made me an appointment for 30 days later. What I had to do was go to St. Vincent and get my problems straightened out.
They set me up for an MRI that took 10 minutes to do. They told me it come back negative. They told me that I could have all the medicine that I wanted. The only thing was wrong with me that I was a psycho ward.
The people are frustrated with timeliness in terms of scheduling issues. We heard the people are frustrated with the care. I think the number one thing that came out was a feeling of a lack of respect for people as patients in the VA healthcare. And yet, it's not across the board, I would say, because we've heard a lot about what they're doing well, and I'm always glad to hear that.
The VA, from the janitoring staff to the food staff, have a blessed day. Can I do anything for you? I don't care where they are or what they do, they stop to help me. So I felt it appropriate to come in and let people know that, hey, my husband's not a general, but they take good care of him. They give me all the support I need. So when I'm hearing these stories, I have, a hard time because I know what I've been through and all the wonderful things they have done for my husband.
I don't have any problems with the care at the VA hospital. I do have a problem with the amount of staffing that they have, because it's almost impossible to take care of that many people with that few people.
People expect that they're able to get in and see somebody. And when you have to wait 4 months for a follow-up appointment, and you may have a serious issue, a cancer screen, a heart issue, you don't have 4 months, okay? And that's one of the biggest problems that we're seeing nationwide.
And we've had 5 troops now from Indiana, 5 veterans, because the VA does not provide hyperbaric oxygen therapy for TBI. These troops are going at the cost of private donations, not tax dollars, to get hyperbaric oxygen therapy and receiving healing and receiving improvement in their care.
The American Legion sees itself as a partner with the VA, and together, through programs like this, through town halls, through the site visits, through the reports, that if we take it in the right vein, that we're working together to improve the health care for veterans. And that's the #1 thing we want to do. Sometimes feelings are hurt, and sometimes toes are stepped on through this process, but that's not the point. The point is, let's work together. Tell us about your issues, tell us about your problems, and let's work together to fix that, because once we can do that, you'll find that we're the greatest advocacy for the VA.